Hydroquinone is a commonly used prescription treatment for dark spots, but it has some downfalls to it. So while it can lighten and it can lighten things pretty effectively, if it is overused or if it's used incorrectly, it can actually cause a paradoxical darkening. So we're trying to lighten spots, but if it's used more than 2 months at a time, it can actually darken them, or it can over lighten spots. It's really tough sometimes to find that balance. We don't want to cause a white spot in an area. We're trying just to get it to even skin tone, and we definitely don't want to worsen a dark spot. So hydroquinone is a little tough to get to that sweet spot, I feel like, and it's not safe in pregnancy. So that's something to consider as well. If folks are dealing with melasma or something, and or maybe their pregnancy or their breastfeeding, it's not safe in those situations. So overall, the more plant-derived, ingredients that focus on hyperpigmentation are much safer. You don't have to worry about taking breaks in it to prevent that darkening. It's not going to happen. You're not going to get that darkening. That is really, hydroquinone alone that does that. So I think it's great to have a non-hydroquinone product that we know will work well.
That makes sense because I know Fade Away is a dermatologist loved and used product as well. And that makes sense because Fade Away you can use a long term, whereas hydroquinone you're saying about a 2 month time period. And so it seems like that's why dermatologists will recommend if they prescribe hydroquinone to someone, then they recommend something like Fade Away to continue using for their spots.
Yes, I completely agree with that. I talk to people about Fade Away a lot because it is such a safe option. And a lot of folks, when they hear those, I'm very transparent with my patients. I want them to know everything that is going to happen to their skin or about the product that I'm giving them to treat. So if I do need hydroquinone for whatever reason, I am very upfront with them that, hey, this could technically overlighten you. It could darken you. We have to use it appropriately to get the right benefit that we want. And a lot of folks then maybe don't want to use it or just want to use it for a very short time. And I like having another option that I know will work well for them, that I can say, hey, this one's super safe. You can use it consistently until you get the result you want. You don't have to worry about taking a break or wondering, gosh, have I used it 2 months or have I not? And so it's just a great safe option to use.